Hello, everyone. Welcome to the show. Another great edition of Bring It in the House podcast show where we spotlight musicians, entertainers, artists, and leaders. And we have a fantastic leader in the house tonight. She has an extensive background in the medical field, especially in the subject of women's health. Let's give it up for Texas wellness practitioner, Miss Marva Durgan. Yay! Uh-oh.
Thank you. Thank
You
you.
are so welcome. Yes, congratulations. I want to kick it off by saying congratulations on all your success. I was reading about all the things. I was looking up your information online. I was like, wow, this lady's been putting in the work. And not only is she putting in the work, and she's not just a lady, she's my sorority sister. As the girl did it.
Thank you for
Yes,
having me on the show tonight.
you are so welcome. Yes. Yeah. So tell us where you're from originally and your alma mater, where you're hailing from.
Yes. So I'm originally from the Dallas Fort Worth area. I'm from Fort Worth, Texas, born and raised. And now I'm living in Grand Prairie, Texas. So I love Texas. That's where I'm going to be. That's where I'm going to stay. There's no better state. So loving it here.
Well, you know what? I'm not a native of Texas, but I
Mhm.
I, I, I kind of agree with you. I love it. I've been in Texas for a huge part of my life now, and I mean the opportunities in Texas, what I can see are unlimited. It's just
Absolutely.
so much here to offer, and if you get in the right lane, and hey, it's no telling where you can go. The sky isn't even the limit. So, what school did you attend? What high school and college and all of that?
Yeah, so I went to Odie White High School in Fort Worth, Texas, and went to UTA Arlington for my bachelor's degree in nursing. And then I also attended UT Arlington for my master's in nursing as well.
Oh wow, that is so amazing! And then
Mhm.
you pledged Alpha Kappa Alpha sorority. Woo!
Yes. Now, actually, I that so nursing is my second bachelor's. So I have another bachelor's in psychology as well before that, and I attended Baylor and Waco. So that's where I pledged AKA. So yeah,
Oh,
in year 2000. Yep.
2000.
All
Oh
2000
wow!
commune chapter. Yes.
Yay! See? Yes, this is an honor to have you here on our platform
Thank
thank I mean,
you.
you are so welcome. Marva, I was reading that you were a nurse for 17 years
Mhm.
and a nurse practitioner for 5, where your focus is urology and women's health. Please elaborate.
Yes. So I worked as a nurse. I said 17 years. Yeah, I guess it has been that long. So I graduated from UTA with my, I mean, sorry, UTA with my bachelor's in nursing in 2007. So from there, I started at hospital, started doing a lot of hospital work. I worked in med surge, also worked in the surgical area, pre-op, surgery, and then post-op as well. And then I also did a little bit of home health as well. So, through those nursing years, working in the hospital for the longest time, and then did home health on the side. So those were kind of my nursing years prior to going to nurse practitioner school.
Okay. And then you moved into the lane of urology.
Yes, yes. I did move into the lane of urology.
And,
So
and,
yes,
and what kind of led you to go in that direction?
well, it was kind of funny because I knew one of the doctors that I worked in the surgery suite with, and he was a urologist, and so he was like, and that's kind of how I got my connect at my first urology job was at USMD Hospital. So I started working as a nurse practitioner at USMD, and from there, that's kind of where I picked up a lot of my hormonal treatment. I also worked at a women's health clinic as well in Fort Worth that treated mainly women's hormone imbalances before I started working at MIDI. And then I kind of branched off into MIDI after being at USMD for a few years.
Yeah. I just want to share, guys, this is how I met Marva. She is my wellness doctor. I call her a doctor, but she's my clinician at MIDI
Yeah.
Health. And I was just so honored, that she's so skilled and has so much knowledge. And she's really helped me as I'm aging, going through this thing called menopause that a
Mm-hmm.
lot of us do not learn about, women. We're not taught
Right.
about it because, especially in my generation, it was kind of like a hush hush subject among women. Usually it would be the older women kind of discussing it softly, and they didn't talk of that subject, before us, the children. So I didn't
Right.
hear very much about it. So, and I never heard my mom complain about
Mhm.
anything. She was just so sweet. I
Yes.
never heard her speak on, sleep deprivation or hot
Right.
flashes or anything.
Right.
So
Yeah.
me, I felt it all. I,
Right.
I
Yes.
did.
Yeah.
Yes.
It's a big deal. And it's funny because you talk to a lot of other providers like primary care doctors and OBGYNs, and they have, to their defense, they have a lot of other special issues that they're dealing with. So dealing with menopausal type symptoms is not really their area. And so MIDI, was developed to deal with these issues, and it's a great resource for a lot of menopausal women and perimenopausal women going through these issues, these symptoms, in this stage in their life, because it's a real problem, and it affects a lot of affects your quality of life, affects a lot of bodily systems, and it it needs to be addressed.
Yes, yes, yes. And we had to get that out of the way first about all your
Mhm.
credentials and how fabulous you are. But the real
Thank
reason
you.
I brought you on here is about the subject about menopause because,
Mm-hmm.
um, for
Yeah.
years it wasn't even covered by insurance. The treatments
Mm-mm.
were not covered by insurance. And then, if you talk to your regular doctor or OBGYN, well, the OBGYN kind of had more advice to give you than just a
Right.
regular, general physician.
Right.
But I am just so thankful that you guys are here in place now to help us, those who have those severe symptoms. Thank you so
Yes.
much.
Yeah. It definitely is a blessing to be able to help women, that are going through a lot of the same changes that I'm going through. So it's kind of like, well, what kind of care would I want? What kind of care would I want from my family, or my best friend, going through the same change.
Mhm.
So it's definitely, and everything that I've gone through as far as like learning throughout my career has, led me to this point to where I'm, actually doing something that I love to do, and that's help women in this stage of life.
Oh, yeah. So when you first got into the field of medicine, I
Mhm.
mean, uh, did you know that you kind of end up in this arena, or you kind of
No,
that was, yeah.
absolutely not.
Yeah,
I did not know. When I first got into, medicine, I didn't really know. You kind of bounce around a little bit and see kind of what it is that you really want to do and what you want to really focus in on. And it's good to have a specialty like this,
mhm,
to focus in on. So once
mhm.
I started doing more and more hormone therapy, which is basically what I did in urology too. I did a lot of hormone therapy replacement in urology and at the women's clinic before that. So to me, it just felt natural to come to MIDI and, expose my skills there.
So urology, kind of break down to us what that means.
So urology is basically the study of the urinary and reproductive system. So that includes like your bladder, urethra, for men like prostate conditions, for women urinary tract infections, and treatment of those kind of conditions. Which I did a lot of that as well in urology.
So what's the difference between urology and what's it, endocrinology?
Endocrinology. So yeah, endocrinology is basically focused on like the glands and like the endocrine system. So the endocrinologists focus more on conditions like thyroid disorders, diabetes, also hormonal imbalance too, infertility, and then like growth issues. So that's kind of the difference, is that the endocrinologist focus mainly or specialize in like the endocrine system, and then the urology focuses more on like the urinary tract and reproductive systems. But both specialties, focus in heavily on hormonal imbalance.
I can hear the intelligence. I love it. I love it. I love it feels good to know that you have a specialist. God knew what he was doing when he, created that line, that extension of the medical field. We're so thankful for you. Before you came to MIDI Health, were you practicing women's wellness at some of the other hospitals?
Yes. So I was doing hormonal replacement at the clinic that I worked at the USMD clinic, and also men hormonal replacement as well. So both male and female. And then also at the women's health clinic, I focused more on like the overall women's health. So that included, not only hormonal challenges, but also, preventative care with, pap smears and mammograms. So I did a lot of those as well while in clinic.
That's so wonderful. Do you feel like, because I've heard people say, I get mixed views about it. Well, hormonal replacement isn't necessary. Do you feel that? How do you feel about that?
Yeah, I feel like hormonal replacement it's not necessary, but it is an option for women. It can provide relief of symptoms. It can also help with a lot of different underlying conditions that can stem from menopause, like sometimes cholesterol issues, blood pressure issues, and sometimes also brain fog or cognitive decline. Hormone can replacement can help with that, and then also help with bone prevention as well. So it's an option. It's not like absolutely necessary. In fact, some patients opt to not do hormone replacement. They prefer to do over-the-counter supplements, or try something more natural, herbal, and a lot of those supplements, we talk about too at MIDI, like, the black cohosh, Siberian rhubarb, ashwagandha. Those are all supplements that can help during menopausal phases as well.
Yeah, that is good to know. So some of the supplements that you take, does that include like the estradiol patch and like progesterone and some of those other?
So, are you talking about the supplements or like the actual hormones?
I guess so. There is a difference between the actual hormones and the supplements. Okay, so
Yes,
let's look at that then.
yes. So the actual hormones they consist of your estradiol oral pill, your estradiol patch, or your estradiol gel. So those are your three FDA approved estrogen replacements. And then you also have micronized progesterone, which is also FDA approved for progesterone replacement. And then for your supplements, that can be like your some things you can find like even at Walmart, like Estroven, that has like the black cohosh in it, the Siberian rhubarb, the ashwagandha. Those are more of your over the counter treatment options for menopausal symptoms.
That's good. I hope women from all around. I hope you guys tune in to this segment right here because this is so important, especially women. I'd say about 50 years old and up. This is so
Mm-hmm.
important. Now, menopause can start early, right? As early as what age?
Yes. So menopause, I've seen women in menopause in their 30s. So, Yes, and sometimes it's like a genetic thing.
Yeah.
With if your mom or grandma started menopause in
Mm,
their 30s, 35 and 36, 37, 38. Sometimes that's a kind of a genetic thing. So you may start to see changes in your cycle where your cycle might get heavier, or it may get lighter to where you don't even have a cycle. And then you start to see the emergence of some of the perimenopause and menopause symptoms like hot flashes and night sweats, the fatigue, trouble sleeping, weight gain. We talk about like the abdominal obesity, where you see more of the weight, kind of falling in the midsection.
mhm.
And, skin and hair changes. That's also a big one around perimenopause. So those are kind of things that you may experience when menopause occurs.
Yeah. And so perimenopause means that early on onset, so to speak.
Yes, early on, perimenopause is more so you're still cycling, you're still getting your period, but you are experiencing a lot of the symptoms of menopause. Even before your cycle stops.
Hmm. Well, that's good to know because
Mhm.
some of us don't know the difference between perimenopause or menopause. We just we're
And
like,
a lot of times the symptoms run together, so
yeah,
it is sometimes
yeah.
hard to differentiate.
Hmm. I'm just so glad to see that this subject is finally getting the attention that it deserves. Yeah.
Absolutely, me too. Yes, it's very much needed. So
So would you say menopause it involves the study of aging women, or would you say it involves the study of hormonal imbalance, or a little bit of both?
I would say it's a little bit of both, hormonal imbalance and aging women. It stems from a change in estrogen and progesterone production. So you have this decline in both estrogen and progesterone. And that's where many women will start to experience these, aging women will start to experience these symptoms because of the hormonal imbalance. So it's sort the menopause is sort of that, it's kind of both. It's intertwined when it comes to like aging women and then the hormonal imbalance. It's a combination of both both of those.
But you would treat both with the same type of medicine or prescription, whether it's
Um,
imbalance or aging.
Yes, and it also depends. That's kind of a general question, but yes, you can treat both with the same treatments, or like I said before, we could kind of go with herbal options or over the counter options for treatment versus hormone therapy. But yes.
Thank you. For those of you just tuning in, this is Miss Marva Durgin. She is a Texas wellness practitioner and she knows her stuff when it comes to this medicine, period, but
Thank you.
especially in the area of, women's health, wellness, and men too, because you help
Mhm.
both.
Yeah.
Yeah, that's so good. So, how do we know? Is there like any kind of little alarm for some women? What's the first sign of menopause? I mean, would it, or there's no particular sign really? You just kind of
Well,
notice that you feel different, right?
right. I mean, so there's not really a particular sign that you notice that with menopause. So if you're in perimenopause, you may start to notice some changes in your cycle. You may notice the emergence of some of the symptoms like the hot flashes and night sweats. When you're in menopause, your cycle has completely stopped. You're in menopause once you haven't had a cycle for 12 months. So that's when you're in menopause. Okay. Technically, that's when you're in menopause. Okay. So, but after, even in that stage, when you're in menopause, you still may have these symptoms as well. And they may be worse in menopause than they are in perimenopause.
Mm,
So
yeah. Woo, yeah. So after you've like had the, gone through the whole menopause experience, like they said back in the day, went through the change.
through the change.
Yeah. Is it like just one big phase and you're done? Or does it like reoccur maybe down the line?
It can
You have,
reoccur. It
yeah.
can reoccur. So as long as your body still has the ovaries,
Mhm.
which most women do, even if they don't, even if they have a hysterectomy and their uterus is gone, most doctors will leave those ovaries in there and they're intact, right? They're still in your body, so they're still, producing, even if it's just a little bit of estrogen and progesterone, your body's still producing those hormones. And so you may have those ups and downs throughout perimenopause, menopause, and postmenopause. You may have those ups and downs depending on, what age you are, and what stage you are in life. And if you have your ovaries, then yes, then you most likely will have those ups and downs and those fluctuations in your symptoms. Mhm.
And then I was reading too. Well, my doctors have told me, like, well, now that you've gone through the change or whatever, you don't have to have a Pap smear as frequently because when you're younger, you have that annual Pap smear. So is that
Right.
true? We don't have to have them as frequently now, or
Well, not as frequently, and the reason, not annually, it's not really recommended annually anymore, and the reason because of that is because we found through research that cervical cancer, which is basically what we're screening for through pap smears, takes years to develop. Okay, years. So if you've had a pap smear last year and then you go to the doctor again this year for the pap, most likely it's going to still be normal. So what the recommendation or guidelines say is if you're 21 to 29 to get a pap smear every 3 years at that age, and then between the ages of 30 and 65 to get a pap smear and HPV screening every 5 years.
oh
So
wow,
yeah, or a pap smear alone and HPV screening alone every 5 years. So that's kind of the recommendation for that. It
oh wow, it's changed, huh? A little.
has changed, yes.
I see. I see.
But pap
Wow.
smears are great. I mean, some doctors want you to come every year, but you don't
Right.
necessarily have to. But so that's just kind of the guideline on that.
Hey. I've learned, well, a lot of this information I was familiar with, but, you know, just breaking it down so that other women can, get a better grasp on, what menopause is all about, what some of the symptoms
Absolutely.
are. Yeah. And you guys are like nationwide, most of the
Oh yeah.
large cities,
Right.
right? You
We're in
are
all
there.
50 states now. We're in all 50 states. We started off, I believe, in 13, 13 states. Now we're in all 50 states. So we're growing and expanding, offering products on the website too, on the MIDI website. Go to the MIDI store. You'll see a lot of products on the MIDI store for hormonal care. Well, non-hormonal care, but also hormonal care, and for symptom management as well. So we have products for skin and hair and sexual health, and things like that as well. So check out the store.
That is so good, guys. Go to www.midihealth. That name right there. Just put the www dot
Hmm.
and then midihealth altogether.com, and you can see,
Yes,
the information that she's referring to right now. This is great.
yes.
Congratulations on all your success. This time has really flown by since we've been
I
talking.
know. Thank you. I appreciate it.
You're very
Thank you
welcome.
for having me.
You are so welcome. Thanks for taking time to stop by. I had one other
Absolutely.
question I wanted to
Yes.
visit. How do you maintain your confidentiality when you're collaborating, with other professionals? Say if
Yes.
I had to go to you and then another doctor, how would I know my information is safe, I guess.
Yeah. So nowadays, most EHR systems or most electronic medical record systems have, things intact, especially for patients, to maintain confidentiality. So a lot of the referrals are, and you have to, as a patient, you have to give consent for that. So, and it's not like it was in the old days where everything's on paper and kind of in charts and things like that. So now everything's electronically kept, and so nothing can be sent without patient consent to sharing of their information. So, and that's exactly how our EHR system is set up, and most EHR systems today are set up that exact way, and most referrals and collaborations are done through electronic health record systems.
Awesome, awesome. And the big bonus is that you guys are in telemedicine. That is so good.
Yes.
Yeah.
Yes. So the convenience is always there. So you don't have to sit
Mhm.
in a doctor's office or, waste gas having to drive anywhere. All you have to do is just log onto your computer and you can get, you know, the wouldn't say the exact same care, but the care that you need to take care of yourself, if you
Yeah,
need it. So
it's pretty close
telemedicine,
to
yes.
yeah, it's pretty close to the real thing because I've had appointments with you online and
hmm
on my lunch break.
Exactly. Yes. So it's nice and convenient for patients who are working and busy, just like all of us are, and having to fit in, doctor's appointments. So we try to make that very convenient for our patients as well. Even if you have to reschedule, it's easy to reschedule. And you can always send messages to your providers through MIDI, and we're all pretty good about getting back to our patients in a timely manner as well.
Yes, yes. How do you feel, Marva, when you know you've matched a patient up with the right medicine and their results are, everything is lining up? I'm sure that's a great feeling for you.
It is. It is a very good feeling, and it just, warms my heart to see my patients, get better, and it just makes me feel good overall. I feel very blessed and, honored to be able to help patients in need, and especially, patients going through perimenopause and menopause who, can't find the help anywhere else. MIDI is kind of that place and that safe place for a lot of women to come to and talk to their provider about certain things that they can't really talk to their other doctors about. So I feel very good, and I feel like a reward, and
Hmm.
within myself, that I'm able to help patients when I do that. Mhm.
Yay! Well, we love what you guys are doing. Thank you again. Do you have any shout outs before you go?
Shout out to Alpha Kappa Alpha sorority, Pee-wees, sorors.
Yeah. Amen. Amen. Oh, and to your family, your beautiful family.
Yes, all my family, my mom and dad, Elbert and Brenda Mitchell in Fort Worth, and my sister, Melva, also AKA, in Fort Worth. So yeah, so those are my shout outs. And yeah, so, and everybody, in the MIDI Health, shout out to everybody there too, all my colleagues.
Oh, that is so good. Any last words of encouragement before we close out?
I would just say to the women who are listening to this podcast, to, if you've been dealing with any of these symptoms, to do not hesitate to reach out for help. We do take insurance. So there's a lot of online platforms out there right now that are on the menopause train, but they may not be taking insurance. MIDI takes insurance. We will work with your insurance companies for a lot of your treatments. So that's just a bonus there. So don't hesitate. Don't be scared to reach out for help. That's what I would say.
That's right. That's so true because, you know, for many years I was like almost a closed subject.
Yes.
Um,
Yes.
I've some women have been told by regular physicians that hey, it's all in your mind.
Right. Right.
Yeah,
Or
yeah,
this is just a part of life.
yeah,
That kind
yeah.
of thing. Yeah,
Yeah.
just deal with it. Yeah.
Yeah. Yeah.
Yeah, we don't have to
So
deal with that. So
thank you, Marva. Thank you again for taking time out to speak with us. And we'll see you guys back here on the next episode of Bring It in the House.